Welcome, everyone. This is the Florida End-of-Life Doula Alliance monthly educational Zoom meeting, and today is April 3rd, 2025. We have a special guest today. Her name is Kate Parker, and Kate is one of the founding members of the Florida End-of-Life Options, and it's a grassroots organization dedicated to educating and promoting and raising awareness in individuals, organizations, and communities, resulting in support for a medical aid in dying law in Florida. And Kate tells me it's a humanitarian mission. It's not political, it's a humanitarian effort. So we're going to learn a little bit about it and who would be eligible to have this option, and the safeguards that are written into the law to protect patients and caregivers and everyone involved. So we are just very pleased to have Kate here with us. And again, if everyone is muted, that would be helpful. So I'm going to let Kate introduce her topic and go for it.
Okay, hi everyone. I'm very pleased that you allowed me to come and make this presentation to you today. I live in the Villages in Florida. Yes, that's right. I thought I said it backwards there for a minute. So I'm Central Florida, and my position basically, although I am one of the co-founders, we have various areas that we sort of manage, and my position is mostly on community involvement and education. And so I travel all over the state, doing presentations and trying to get petition signatures and whatever I can do to raise a groundswell of support for this mission. So I'm going to go ahead and get right into my presentation, which will tell you all about the medical aid in dying law that we're trying to get. And let's see, is this my slideshow? Here we go. So can everybody see this okay? Yes, okay, got it. So we're a 501c3 nonprofit organized in the state of Florida. And we are trying to, like I said earlier, to educate the public, the legislators, the medical community, health caregivers, basically everybody about this humanitarian law. So what is medical aid in dying? And actually, you may hear it referred to as several different things, like Florida End-of-Life Options is the bill that we have in both houses of Congress right now, Florida State. And sometimes, so that's the name of our bill, Florida End-of-Life Options. We organized under the name Florida Death with Dignity, which was based on the national organization Death with Dignity. But we're in the process of transferring or rebranding so that our name matches the name of our bill. So you may hear us talking about, if you hear Death with Dignity, you know it's the same thing that we're doing here, Florida End-of-Life Options. And I don't think I've got my slideshow here completely updated yet. So don't be confused by that terminology. Basically, it's all the same. So, and that's the name of our group and related groups. But the process is called medical aid in dying. And medical aid in dying is an end-of-life option that allows individuals to legally request and obtain medications to end their life in a peaceful, humane, and dignified manner at the time of their own choosing. Medical aid in dying does not result in more people dying. It just results in less suffering. Medical aid in dying is legal now in 11 jurisdictions. That's 10 states plus Washington, D.C. And you'll see, as things usually go, it's, you know, it starts on the coasts, both coasts, and then sort of works its way into the center. I know right now there are probably another 20 states that have good grassroots organizations like ours that are trying to get it going in their state. So it's a law whose time has come. So this bill is full of safeguards and for everyone concerned. And one of those safeguards is having an eligibility requirement. So to be eligible to take part in the Florida Death with Dignity or medical aid in dying, you have to be an adult Florida resident, age 18 or older. You have to have a terminal illness with a prognosis of 6 months or less to live. And you have to be able to make your own healthcare decisions, the mental capacity to make your own healthcare decisions. And you have to be able to self-administer the medication. So because of this mental capacity, regulation here is this will not work for people that have like Alzheimer's or other dementias, or like in a coma, or, you know, somehow not able to make their own healthcare decisions. That is primary, because this is something that only you can do for yourself. Okay, so this is not euthanasia. When I talk about this, a lot of times people will say, oh, Dr. Kevorkian. Well, you know, Dr. Kevorkian did it for others. That's called euthanasia, where he does it out of compassion or mercy killing, same thing. That's euthanasia. But this is not euthanasia. This is something that a patient would make, the decision that they would make and actually do for themselves. So our law is based on the original law from Oregon 28 years ago. And I think one reason why virtually every state that has this, and in fact, all of Canada and Europe has some places in Europe are quite a bit more liberal than we are, but in the States, they're all based on that same Oregon law. And that is because the Oregon law, and so again, the law that we're trying to get passed here in Florida, has safeguards for the patients. It has safeguards for the medical cares, doctors and facilities, and the law works as it is designed. When this law passed in Oregon, it was fully litigated because they had all the same obstacles that we're having. You know, the ultra-right Christian groups were against it. And at that time, the Americans with Disabilities were against it because they were all afraid of the slippery slope. Like, we let this happen and then we'll be changing it and pretty soon kids can do it, you know. But that hasn't happened in 28 years. The law works as it is designed. And so these are the safeguards for the patients. First off, you have to have the mental capacity to make your own medical decisions. And this is confirmed by 2 doctors that have to agree that you have this capacity to do this, or else they send you for an evaluation to someone that's their job that they do. The patient has to make 2 verbal requests with a waiting period. So it can't just be, you know, a manic, I'm done. You know, it's something that they have well thought out and thought of the consequences, and they understand the consequences of doing it and the consequences of not doing it. And they understand all their other options. Then you have to make a written request with 2 witnesses. Now, one of the witnesses can be a loved one that's in your will or, you know, in your family, but the other one has to be someone that has no financial interest whatsoever in whether you do this or not. So, you know, it could be your neighbor that you've been great friends with for 30 years across the street, but she's not in your will, you know, someone who just knows that you're of sound mind and that you're making this willingly, that, you know, no one is forcing you or coercing you to do this. And another safeguard for the patient is that life insurance policies, wills, annuities, actually any legal contract that you enter into cannot reference a medical aid in dying. Whether, like, if someone offers to buy your life insurance policy, you know, because you're like 6 months, so you qualify and you want to go ahead and cash in your insurance so you can spend the money and do things that you want to do now. No contract that you enter into can say, sure, we'll buy your life insurance policy, but you have to take the medical aid in dying cocktail, you know, like within 30 days or 60 days. No, that's not a legal contract. Life insurance policies, this has been fully litigated with the insurance industry. There's not even a question. They understand what you're doing and they pay your life insurance out there. So you're protected from people making contracts with you based on if you do or if you don't do the medical aid in dying. So that is another safeguard for the patient. So this also safeguards the medical healthcare providers, doctors and facilities, home healthcare. One of the safeguards for the doctors is that it requires that 2 physicians confirm all the eligibility requirements. So no one can say just one doctor had an agenda. 2 doctors have to agree that the patient qualifies. No medical professional will be forced to participate in medical aid in dying. If they don't want to, simply if they don't want to, they don't have to. If they find it ethically or religiously against their own values, they don't have to. Or they can, and they can change their mind at any time. And once we get the law in the state, the doctors and the healthcare facilities, the whole healthcare thing, they will have to determine whether they're going to participate or not. So it's clear to the patients that, yes, this facility will allow this and this facility will not. So it'll be very clear to the patient, to the public at large, who is participating and who's not. And then medical professionals are protected from civil, criminal, and administrative prosecutions and liabilities. And that basically means, you know, how doctors sometimes they will work at various locations, like maybe they work in a religious hospital, like say St. Timothy's Hospital, but they also work at the Florida University Hospital. Well, the University Hospital will allow medical aid in dying because it's legal, and so they would be allowed to participate. But the religious facility may or may not, and we know if it's a Catholic one, it'll be a no. So so they are protected from, if they work at both of these places and they choose to participate in the medical aid in dying, that when they're working at the religious facility, they can't be sanctioned or treated differently from anyone else, and their hours can't be cut, their privileges can't be cut, because they're participating in it in a different, like over at the university. So there can't be any retaliation, like, well, if you're going to do that, then we're not going to allow you to do this here. You know, so their careers will not be jeopardized one way or the other by whether they choose to do it or not. And another big protection for the healthcare community is that if the doctors follow the rule, the law, which is outlined very clearly, step by step by step, how everything has to proceed, even to the point of like the written request, the state actually, the bill provides the terminology for the letter. And so then the doctor just gives you the letter, you fill in your name and your date and your witnesses. So if they follow everything according to how it is very clearly outlined and stepped out in the bill, they are protected from civil and criminal lawsuits. So family members or other interested parties cannot sue doctors for giving the patient this medication. So then they're not spending all their time and their efforts, you know, even if it's legal. Now, if they're being sued, they have to defend themselves. They have to get lawyers and spend all this time and money in courts and whatever defending their actions. But if they follow everything according to the law, they can't be sued. The law will protect them, and they certainly won't be sued for murder or euthanasia or any of that thing, because again, they have followed the step-by-step directions. So that's a huge protection for the doctors and other caregivers. So like when this law first passed in Oregon, of course, there were lawsuits, you know, accusations of, you know, euthanasia and murder and whatever. But the law protected the doctors and the healthcare workers. And so they felt more, because the doctors were afraid to do it, you know, they were afraid of spending all their time in court and fighting off lawsuits. But when they saw that the law works as designed, then they were able to just do it based on their own desires. And we're working right now, we have a whole group that works with the medical community right now, educating them, telling them what the law is all about, and just being a whole part of that process before it's even a law here. Because once the law passes, you know, we don't want to wait. We want to be able to get right into it. So who supports medical aid in dying? This is a 2020 Gallup poll. It's the last Gallup poll that we have that actually surveyed the whole country. And this was 2020, so pre-pandemic. And at that time, 74% of Americans or adults were in favor of medical aid in dying option at the, you know, as an end-of-life option. And if you look at the poll here, the demographics that they polled and how they voted, so you'll see men and women, all racial groups, all age groups, whether the patient, whether the poll, whether they were graduated, you know, their education level, their political leaning, whether they're conservative, Republican, Democrat, liberal, whatever that, they were all still in favor. And even down to going to the most conservative of the religious groups, the conservative religious groups, even in 2020, pre-pandemic, 55% of the most conservative groups, that's more than half, were in favor of it. And up to 82% of people that consider themselves religious or spiritual, but, you know, don't necessarily go to church regularly. But that was in 2020. Now, 5 years later, with so much more education, more states having it available. And I think, just people being 5 years older and whatever. I know. And in fact, we're trying to get one funded right now for just Florida to help us get it passed in Florida, to get a poll taken in Florida. And I'm sure that these numbers would be quite a bit higher, even here in very conservative Florida. I live in the Villages, one of the most conservative places in Florida, and therefore the whole country. And when I'm out on the market nights, talking to the public, talking to people and getting petition signatures, I get about 75% of the people that I talk to are willing to sign my petition. So I feel very confident that if we could just get the word out there, get the education, and get the grassroots, that the lawmakers will see that it's something that we want and their people want it and will be willing to vote for it. So who opposes medical aid in dying? Well, according to the 2020 poll, 26% of Americans oppose medical aid in dying. Some religious groups, some medical groups, some disability groups. So let's look at the religious groups first. So we've got a number of polls here that we're pulling from, but in 2016, so this is 9 years old. So again, I think these numbers are all less than what they actually are, but these are actual polls. We're not making up these numbers, okay? 67% of people of all faiths are in support of medical aid in dying. And if you look at here, the Catholics, I was surprised. This was the most surprising thing to me. 70% of Catholics are in favor of medical aid in dying, even though the Pope and the church as an organization are a hard no. But when people understand and have the compassion and seeing people, their faith is bigger than the rules of the church or whatever. And I'm even talking about Catholic priests who are in favor of it and support it. Generally not Catholic priests that run a Catholic church because, they have to account to the hierarchy of the church. But many Catholic priests that are now clergy or, just in the field, not actually running a church. Surprisingly, again, 70% of Catholics. And the thing that surprised me also was how few, the 53% of the Protestants. And I think that goes, and especially when I always thought of the Catholics as being much more conservative than Protestants, but you see here, there's a large ultra-conservative Protestant group that are against it. And then again, the Jewish people, they accept it, 83%. And basically just people of all faiths, 70%. And you see down here on the lower level where it says, you can see the 55% of those that are the most devout weekly churchgoers, 55%, but even at that, that's more than half. And this was from the 2020 Gallup poll. So even though we do have a fair amount, 26% of the ultra conservative Christians are against it, the rest of people with faith are for it. Okay, so moving on to the people with disabilities. When the law first passed in Oregon, the people, Americans with disabilities were a hard no. They were afraid of the slippery slope, and they just didn't want to put their people into the position of being coerced or, urged into doing this against their will. But like I said, since, 28 years of data have proven that the slippery slope hasn't come. People with disabilities, and the various disability organizations have actually changed their stance from no to neutral, saying that it should just be everybody's own decision. And this is a poll from, can't see my notes. It's a fairly recent poll, like 2019, I think, where these 3 states polled people, only people with disabilities, and asked them if they are in favor of this. And you will see New Jersey, 63% of people with disabilities, Connecticut, 65 people, Massachusetts, 74 people with disabilities, all were in favor of the medical aid in dying. So even the Americans with disabilities are largely in favor of this. And then the support from the doctors. And again, 2020, if you look here, 55% of doctors were in favor of this, completely in favor of it. with 17% saying it depends. So if you take the 17 and the 55, you know, that's 72% of medical doctors that support medical aid in dying. And this doesn't include the nurses and the other aides and caregivers that, you know, are right down there every day with the people that are, you know, in the last hours and in that daily turmoil. The numbers of those health caregivers are much larger, as you may imagine. So in Florida right now, we have these end-of-life options: the right to decline treatment. If you are in need of kidney dialysis, you do not have to take it. You know, you can start it and just change your mind and just say you're done with it, no more. That's your right. You have the right to hospice care. That's your right. Palliative care, where they try and, you know, keep you sedated or at least, you know, provide you with the drugs and the medications to help ease your pain. In Florida, that's legal. The palliative sedation is where you go voluntarily into a coma until you die. That is our legal right, but I'm not aware of any healthcare facility or agency that's in Florida that is willing to do that. But if you could find someone, that's your right. I think they're just afraid of being sued. And voluntarily stopping eating and drinking. Nobody can make you eat or drink against your will. So there's that. And, you know, they're not all very pleasant, and they're so there have been other benefits that have come from this medical aid in dying movement in the last 28 years. When doctors used to go to school, you know, they would be going through their regular medical curriculum, but they weren't really taught about, you know, what do you do in the end? So, you know, y'all know the stories of, you know, you've been fighting this cancer or heart condition or whatever, and the doctors finally just say, you know, there's just really nothing else we can do, or nothing else that you're willing to do that we can do. And so, you know, go home, get your affairs in order, and just, you know, live the best you can. That's how it used to be. Your doctor would say there's nothing else that they could do, and, you know, goodbye. And the patient would just be left there trying to flounder around, trying to figure out what to do next and how to do this or how to do that. Now doctors are actually taught in med school end of life care. And because of that, there's better communication. There's all kinds of media and educational materials available to doctors, and they give them out at doctors' offices, in fact. Patients, people, the population is better educated. You know, everybody, well, not everybody, because I still run across people that haven't even heard of this before, but, you know, people are being better educated on end-of-life options and what they can do to take advantage of the options that they want. And overall improvements. I think one of the things that came from it is just larger investment in hospice care. So before people, if they were going to hospice, they would be in a facility. And now there's so much more in-home hospice care. And that's by and large, excuse me, that's by and large coming from the whole beginning of this end-of-life care that started in the late 80s or whenever, and it has been ultimately just getting bigger and better. And it allows more people to die in the comfort of their home or wherever they would choose. So basically what we're trying to do is let the individual decide how they should have the right to decide for their own selves, how they would choose to die when it's within their own hands. So that's kind of my presentation. If you're interested in helping in any way, one of the biggest things that you could do for us is tell us your story, why you support it. I know, like, my story is that my mom died a terrible, terrible death. She had bone cancer, and it was so painful, and she was in hospice care, but they couldn't alleviate her pain. They would, you know, get her a little bit drugged up, and she would, you know, sleep for 10 or 20 minutes, and then she would just wake up, you know, screaming, just let me die, just let me die. 2 weeks of her life was like that, where it was horrifying. And it's like, you know, this is America. Nobody should have to beg for death. And so that's my story. I lived on the West Coast. I lived in Washington State for 27 years. And we've had this law there for so long, it didn't even occur to me that we didn't have it across the country. So when we moved to Florida, it took me a number of years to figure out that we didn't have it here. And so as soon as I found out that we didn't have it here, I started looking to find, well, where's the Death with Dignity activist group, and couldn't find anything online. So I called the national org and said, put me in touch with your people in Florida. So, and they said, oh, interesting. We just had a guy last week from Florida call. So we're going to connect you two. And so that was the beginning of our beautiful relationship. Tony and his wife, Elaine, my co-founders, live in Melbourne Beach, and they focus on the legislative and the medical side of the organization, trying to work those fields, where I try working more with the public at large. So one of the most valuable things that we have is people telling us their story, and in a quick 60-second, 90-second video, just saying why they are so passionately in favor of this, and that works when we can show lawmakers these little videos, and it doesn't take a ton of time, but you just see the humanity of it, the compassion that this law allows people to have. That's one of the easiest and best things that you could do to help us. And it doesn't take ongoing time. And, it's a one and done. And then we have that video that we can use. Letters and cabling events. And in fact, I see that a lot of you come from various places. I see there's quite a number of you from the Gainesville area. I'd be more than happy to come up to Gainesville and help you get some presentations going there, live presentations, talking to people on the street. So if you're interested in participating in this in any way, send me an email. Here's my, I'm going to put my contact information here. I'm at this bottom one here, down here, kp.fldwd. That's my email. Send me an email if you want me to come and work with you in your location, and we'll work something out, because the more little groups of people, the more active cells that we have around the state, the quicker that the lawmakers will see that we've got this grassroots, and there's so many people that want this bill, they won't be able to deny it anymore. So that's my presentation for you. I was going to tell you right now, we have two big initiatives going. One is because our largest opponent is the conservative Christian group. Last summer in our off season, I started an initiative trying to get faith leaders in Florida. So an interfaith initiative, interfaith support for medical aid and dying. And I've been contacting and working with clergy all across the state, trying to get their support, get a statement of support and a photo for our website, and that we can use in other social media, because the lawmakers need to know. They're hearing plenty from the conservative Christians, but they need to hear that there's more to it. There's an opposite, there's a counter to that there are many Christians, as we saw in the polls, there are many Christians that are in favor of this. So one of the big initiatives that I have going right now is working with clergy across the state, trying to get statements of support and get little cells group going in their areas. And I think I mentioned this briefly, that we do have a bill in both houses right now. It's in committee. And so we have until basically another 2 or 3 weeks to get it out of the first committee into the next committee. So I don't think we're going to get a lot going. We're not going to make it this year to get our bill all the way up to the governor's desk. But the longer that our bill is there, and we're dealing with the lawmakers and regularly building relationships, building support, that's another big thing. So
to find that bill, we just Google Florida end of life options.
Yes, I can give you, it's the House bill is HB 471.
Okay.
And the Senate bill is SB 1700. They're identical bills, so if you get one of them, you got them both.
Thank you so much, Kate. You've given us a great deal of information here, and just such a good overview of what you've been working so hard to do here with this. Yes, so we have a few minutes. I see some hearts flying around, and we have some questions let's see. Do we have a question? Anyone here who'd like to ask a question, either raise your mechanical hand or okay, Marietta, let's see. And we only have a few minutes, so we'll try to be brief with our answers.
Okay.
All right. My question was, can somebody put their wish for MAiD in their advanced directives before they have a terminal illness?
No, sorry, this isn't an advanced directive thing. You have to, at the time that to qualify, At the time that you qualify is when you're allowed to make that choice.
Okay.
So if someone has Alzheimer's, like Alzheimer's is very strong in my husband's family. So and other like in Switzerland, they allow for someone to put it into their advanced directive. And then when the time comes, they can go to Switzerland and do it. So that's what we've done in my family, because it's not ever going to be a part of what we have in Florida. So that's just what I tell people. You can get it done in Switzerland, but you won't be able to get it done in the States anywhere.
Okay. And then we have Dee Dee next with a question.
Yes, I really appreciate this presentation. And I was wondering, what is the process? Is it just one medication you take that in order to?
It's a cocktail of drugs. It's a cardiac, respiratory suppressants, anti-nausea, anticonvulsants, sleeping aids. They want it to be as peaceful and quick as possible. So there's anyway, and generally speaking, you take these pills and then, you crush them and mix them with a liquid and you drink them. And then within 15 minutes or so, the patient is asleep. And within the next few hours, the patient has passed on.
And Christine, who is also on our board.
I'm putting my questions in the chat as well. I'm just curious about the history of this legislation, because I understand the language and that it's well documented, and where it comes from. And as you know, with any amount of advocacy for any issue, it really does come down to who's seeing it and who they're hearing from. So I understand the necessity of a statewide poll and the basic data, but where are these relationships that need to be made so that the key legislators who can advocate for this are the ones who are most educated?
I'm not quite sure what your question is. We do have a whole team that is working with the legislative, their aides and the legislators themselves, educating them on the law and all of that. Is that your question?
Basically, yeah. How can
Yes.
we help this legislative process as opposed to just
Oh.
writing a general letter?
Well, never underestimate the power of these letters. Writing letters to your legislators is good. Making a little video that we can show to the legislators. Like when the legislators have their town meetings, we encourage everybody across the state to go to their town meetings, and you can show these videos. Like, you get like 3 or 5 minutes. If you can show a 90-second video and then make your statement, that's really powerful. So there are various ways that you can help educate the lawmakers, and that ultimately is how we're going to get the law passed, because we're never going to get a ballot initiative.
Okay, great. Thank you. We're going to go to Liz.
Hi, everyone. Let me just lower my hand because I'll forget. Thank you. Can you hear me okay?
Mm-hmm.
Wonderful. Okay, just want to thank you for the excellent presentation. It was fascinating, and I appreciate you sharing this with us. I just want to genuinely thank you. So by day, I work as a social worker at an ALS clinic, and I'm curious as far as what has the response been from the ALS community who are cognitively intact, but they cannot do a written request and they cannot administer the medication. And I'm wondering if there's any precedent in other states of a person who has ALS and does not have the physical ability to administer the medication. If there's just any talk from the ALS community about that.
I don't know specifically about the ALS, but there are ways to get the letter, to get the written request. You can speak right. You know what I'm saying?
Okay.
So
That's
if a person can speak, they can speak right. And like if a person has a feeding tube, they have to, the bill is written so that the patient has to make the positive movement to take the medication. So even if they can like move their hand to the whatever it's called, the plunger or whatever, that where the food goes in a food tube, or if they could reach their hand out to grab the glass with the juice in it, and then someone can help hold it in their hand. But if they make that positive movement towards getting the medication, that counts.
Thank you. And the second question is, what has been the, I guess, temperature check from the physician community in Florida about this? I got the Gallup poll information, but I'm curious in Florida specific, what is the temperature of physicians in our state?
I think by and large, it's widely accepted along those same lines as the people that have the religious objection is the by and large, the largest objection. Doctors may not feel comfortable. They may have an ethical objection, but I think by and large that the doctors that work with the elderly and the terminally ill people, they understand and they're for it. Whereas your general practitioner that, sees you for your fever or for your, a broken finger or something, they may not be as fully aware because they're not the people that are there at the very end after you've had this terminal illness. So
Got
there's
it.
a
Thank you.
large amount of support in the medical community.
Thank you.
So I have two quick questions too. So you have to be a resident of Florida. What is the time that you have to have been a resident of Florida?
There's not a time stipulation. It's just that you have to have an address. So
Really?
yeah,
Okay.
and by the time this law actually passes, we may not have a residency requirement. But because as Oregon had a residency requirement in Vermont at the beginning of their laws, and they've rescinded those residency requirements due to some kind of interstate commission law that goes back, way back. And somebody sued them because they lived in a different state and was like, well, they have to come and live there. So I don't know the whole facts of that. So Oregon and Vermont dropped their residency laws. And I think that most of the states that have residency laws are in the process of dropping them. But for Florida, our ultra conservative, this year's bill, we left the residency requirement in there thinking it would have a better chance. In future bills, we've already been talking, let's just put in everything that we want it to be, and then they can negotiate it up. But
Okay.
so there isn't currently a residency. You have to live here. You have to have an address. That's all. It's not like you don't have to live here 30 days or 6 months.
I just have a comment. I think it was a little unfortunate that the Gallup poll, along racial lines, they said you're either white or you're non-white. It's
I
just
know, I
a
hate
little.
that.
I
I hate
just
that.
had to say that because it's just kind of pretty old-fashioned and
I know.
outdated. But anyway, it's not about you, but yeah, it's just the Gallup.
Well, no, but I think there was a lot of concern about the minorities feeling like they might be coerced at a higher level than
Sure.
the Caucasians. I mean,
Yeah.
that was
I
a
get that.
legitimate concern, and that's probably why it was in the poll to start with.
Right. But my other question is, how long is the waiting period between the two verbal requests and then the waiting period? Is there one between the second verbal request and the written request?
I think
Waiting
we're asking,
period.
okay, all right. So I think we're asking for 7 days, 5 or 7 days after your first verbal request to make a second. And there is no waiting period after the second request. When you make your second verbal request, you can make your written request at the same time.
Okay, great. Okay, wow, this is a lot of information. I really didn't know very much about it. I'm really grateful. Are there any other questions? Anything okay, Christine.
Sorry, again about the legislation, just the step-by-step how to get this passed. Is there anything that's been changed in the iterations that you mentioned this year? It's this, last year it was this. Is there anything else that you see shape-shifting that makes Florida any different?
No, nothing is we're all still based on the Oregon law. When Oregon and New Hampshire or Vermont lost their residency requirement, we thought about just taking that out, because every year when you submit your bill, it's a whole new bill, but we're using the same bill. But this year we thought, well, let's just make it, instead of a 15-day waiting period, let's just ask for 5. I don't remember if it was 5 or 7 that we actually went with. And then we talked about dropping the residency requirement, but there was some feedback within the group, like, let's not, so, but I think as we get more into this, we're going to ask for the things that we want. And then if it can be a point of negotiation, like, we're going to require a residency requirement, but then you can have the law. Well, okay, we can deal with that later. Let's just get the most that we can get the quickest.
You mentioned that we only have 2 to 3 weeks before it's going to be
Yeah.
voted.
Yeah, 2 to 3 weeks. And as far as I know, it's not on the agenda even to be on a discussion. So like I said, I don't have a lot of hope that it's going to make it this year. But there have been a lot of things that have been going on, the special elections and the whole new crop of lawmakers in. So they've got a lot going. And so, but we're undaunted. We keep going, I'm in this. I don't want to have to suffer like my mom did. I don't want my kids to have to suffer like my mom did. I don't want anybody to have to suffer like my mom did. I'm in this until until we get it or I die trying.
Kick the bucket, right? All right, and I see we have another question. Sally, or comment, you're muted.
Yeah, thank you. I just had a quick question. Thank you for this. I've been working with Helene for a couple of years, but contacting legislators. I just wondered if you had a sense of how long it might take in Florida. Of course, there's not a state in the South that has enacted this. And also, it seems like the Democratic states, this seems political in many ways. The states that have medical aid in dying are blue states. The states that don't have it are red states, am I right? And so that makes me suspicious that it's going to be very difficult in these states in the South. Just want to hear your comment about that.
Well, my comment is that I live in the villages and I spend a ton of time out on the town squares, talking to people, getting petition signatures. I go to county fairs and farmers markets, and I get 75% of the people that I talk to sign my petition. And the 25% that don't usually say, oh, that's in God's hands. So I feel very strongly that we are going to get it. We're in a very unusual political climate now between DeSantis and Trump and all of this. This is not normal. Even for Florida, this is not normal. And we are just going to work our way through it, and we'll still be standing when they're all gone.
I have one other question. Do you have a suggested form for these letters? I've not been privy to sending letters into senators and representatives. So is there like a suggested?
Does
Yeah.
your website have all that information of how to get involved and do you think?
It does. I'm not sure if there's a sample letter there or not, but if you go there and you look, because we were in the process of redoing our website and getting a new website, and something happened beyond our control, and so now we're back to square one. So the things that we had planned for our website are now at the bottom of the pile again until we get back up there. But if there's nothing out there and you would like some guidance, send me an email and I will get right back to you with any kind of help or aids that you're asking for.
Thank you. And thank you for this presentation. It was so informative. Really appreciate it.
Thank you.
Yes,
It's been
thank
my
you so
pleasure.
much.
Yeah.
I'm putting it again in the chat. We always appreciate donations if people are able. There's a link to the field donate button. We always provide what we love to do for free, but we also have expenses, and we received our nonprofit status in June of 2024. So anyone who's willing and would like to help out, that'd be great. And I just also want to acknowledge Christine is our vice president and Chris is another board member. Raise your hand so they see who you are. There's 3 of us here today. We have a small board of 4 people right now. And Field is very happy to be involved in our community. Education is our prime purpose, really. So I want to thank everyone for coming.
And I'd like to thank everyone for having me too. Thank you so much. I appreciate it.
Thank you, Kate.
Wonderful.
Okay.
Yes. Thanks.
Bye.